Imagine walking into the pediatric hematology oncology unit of a hospital. You open the door of the isolation room, and you see Jenny, a 9-year-old with developmental delay and a huge tumor on her eye. She's new to the unit. She normally gets her procedure done in the outpatient. However, the tumor is starting to grow and would start to bleed tremendously. That's why she needs a little bit more intensive care right now. I walked in the room, wanting to introduce dance movement therapy and child life service to her and her family. As I opened the door, Jenny stopped what she was doing, and she looked at me. And she held her breath, and every muscle in her body started to tense up. I took a step towards Mother, trying to say hello and ask for permission to talk to Jenny. As I took that step, Jenny started screaming and kicking and throwing her body all over the place. Mom's starting to worry that Jenny's tumor is starting to bleed, and she was about to ask me to leave. And right at that moment, I started tapping on my laps. I get scared when new people walked in, and I don't like it. Jenny stopped screaming. She looked at me. Her body relaxed a little bit. I go back and go, I get scared when new people walked in, and I don't like it. As I walk a little bit closer and closer to Jenny, Jenny kept looking at me, and from her look, I knew that I've got her permission to stay. Right now, I'm right by her bedside. I took out an iPad with a sing-song app, and we extended our movement from tapping on our body to tapping on an iPad. Now, we're laughing, we're singing, and we're dancing. Mom looked at us with a huge relief and surprise, saying that, it's the first time you laughed since you got admitted. By tuning to Jenny's body, I reflected back to her in a rhythmic pattern. It gives me a way to get into Jenny's world. And it's very important because that's actually verbalizing what Jenny's going through and making sense out of the situation for her and people around her. One of the things that Jenny has to go through almost every other day is getting her dressing changed for the tumor. And it's always a very, very difficult time because she would get so nervous and it hurts. The medical staff didn't know what to do, how to get her cooperate, so they would have to give her sedation. However, every time when the sedation is starting to wear off, Jenny would be so nervous and she would start kicking or trying to get up, which actually caused more bleeding. And Mom told me one time they actually had to give her 4 doses of sedation in one dressing change. In order to help Jenny and I co-created this dance together, a dance of being still, being calm, and then we end the dance by thanking the medical staffs. I was able to catch Jenny's dressing change a couple of times, and whenever I'm in there and I see her being in this awake and not awake state, I'll start doing our dance of being still, being calm, and thanking the medical staff. When we do that, Jenny only needed 1 or 2 doses of sedation. Our work together has helped Jenny to gain mastery in this hospitalization, has helped Mom to get a little bit more relief out of this pain seeing her daughter suffer. It had also helped the medical staff, giving them a way to have Jenny cooperate and have him working as a team. It's an honor and privilege to be able to work with this family and know that my work as a dance movement therapist is making this unbearable experience just a little bit more bearable.